Ready to Pass Incorporated and Clex Review, and I have with me Letitia Weeks. A few days ago, I had announced that I was looking for somebody that was battling cancer so that I can give them a scholarship to an upcoming review to ease the burden a little bit. And I didn't know who the person would be. I didn't know where the person would be, but I have found her, and she is actively almost finishing up her treatment with her third bout of cancer. So Letitia, tell us a little bit about your first time, your second time, and now your third bout with cancer.
All right. So when I was a teen, I think about 13, my stomach was growing. And, around that age, a lot of people are, I guess, sexually active. But for me, I know that was not the case. So I told my mother, and then we went and got it checked out. And so I traveled to North Carolina, and that's when, they did different testing and they saw a big tumor in my stomach that weighed, when I did the surgery, they said it weighed about 10 pounds.
Wow.
So with
How
that,
old were you at that time?
around 13, 14.
And when they did it, what exactly was it? What type of tumor?
It was they call it a teratoma.
Okay. And it was
So
on your ovary.
yes, so with the size, it damaged one of my ovaries, so one of them had to be removed.
At
And
13.
yes,
So you lost an ovary at 13. Wow.
and then after they did the surgery and removed it, they said it weighed about 10 pounds with
Wow.
different things inside of it, hair follicles and different stuff. And then I did my chemotherapy after.
So now fast forward, then you find out that you have cancer in the right breast. Is that
Yes.
correct? It started in the right breast.
Yes. So um, after going through that, about 9 or 10 years after, then I felt a lump in my breast while I was doing my random check, and I kind of ignored it. And then I said, when I did it again, I said, no, this doesn't feel right. So I told my mother, and so I had it get checked out. And usually at 20 something, people are not concerned about you doing mammograms because of your age.
Of course.
So but for me, my history, um, the doctors that I work with or work with me, they made sure to consider me going and getting a mammogram done. So I got a mammogram done, and it showed the 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 lump in my breast. So from there, I went on and got different studies done, and so which it confirmed that it was breast cancer.
So at that point, you decided that you were just going to do a lumpectomy. Is that correct? You just removed the lump, or did you remove the right breast at that
I
time?
removed the right breast, so I had a right mastectomy.
So you had a right mastectomy and you decided to keep the left breast at that time. And
Yes,
then fast forward now, the cancer comes back in the left breast, which
yes,
is what you're just finishing up your treatment for that. So
yes.
tell us now about the left breast cancer now.
Okay, so the same thing. I just randomly decided to do my little breast check, and I felt the lump. And then again, I kind of dismissed it. And then I was like, okay, this isn't feeling right. This isn't making me feel comfortable. So I decided to ask my mother if she felt the same thing I was feeling. So then again, I went to my doctor and had it checked out. Then I did a biopsy and it confirmed it was breast cancer again in the left.
So ovarian cancer at approximately 13, breast cancer in the right breast approximately age 23, and that was, you had shared with me, HER2 positive breast cancer. Fast forward now, you just turned 35,
Yes,
and now you have the triple negative breast cancer in the left breast. So
yes,
for people that don't know, there's different types of breast cancer. It could be estrogen positive or progesterone positive. So they call it ER, PR positive, HER2 negative, literally spelled HER with the number 2. And before I personally had breast cancer, I didn't even know that there were different types. But definitely learned that the triple negative breast cancer causes a lot of death in African American women, which is the type that Letitia is currently battling now, along with it being her third bout of cancer. So first, I just want to tell you congratulations. And the reason why I'm calling this Takes One to Know One is because I am an 8-year breast cancer survivor, and I could not even imagine trying to battle cancer on 3 different occasions. So it
Yeah.
came into my spirit as part of our 18-year celebration that one of the scholarships that I was giving away would be to somebody that had to battle cancer while in school. So you did some of your training in Puerto Rico
Yes.
to get your RN, but you've not been successful in passing. So tell us how many times you've taken the test and when you're going to take the test again, the NCLEX specifically.
I tested about 5 times. So my goal is to try and get it done before the year ends, hopefully by September.
Okay, so we have a class coming up July 14th, and you said that that would be the class that you would attend. It's going to
Yes.
be a live online webinar, and I'm going to be super excited to come back with a good report to let everybody know that after 3 battles of cancer, as well as 5 attempts, that you are going to meet your dream of becoming a registered nurse. And I really congratulate you for having the fortitude to fight, because I know personally, I had a bilateral mastectomy. I had 10 surgeries from 2013 to present. I had chemotherapy, and at one point, my head looked exactly like yours. And nobody really knows what it's like to suffer until you have suffered. So that's why I'm very compassionate, because I didn't do it 3 times, but I did it 1 time. So I can only imagine what it's like to have walked that journey 3 times, and the type of strength that you need to be so resilient to even try to, and I know you're tearful, because what are you tearful about? I know it's so much, but tell me, what are you thinking? What are you feeling? What's going on in your head now?
I guess more so it's a blessing to still be here because, like I've told you before, my aunt passed away with breast cancer at a young age, leaving behind children. And so I have a 7-year-old. So trying to explain that to her and trying not to worry her, it's but I'm still here.
You are here, and every day it's a fight. And you know what's so funny? When I was diagnosed with breast cancer, my daughter was 11. And if this is any encouragement, she turned 19 years old today. So I'm going to speak it into existence that you are going to live to see your daughter's 19th birthday just like me. So I am excited today because I absolutely understand what it is that you're saying. My son was 18, and he has autism. So imagine you have a 7-year-old daughter and you have an 18-year-old son, and then you find out you have cancer, and then you have to have all this chemo, and you have to have this surgery, but yet you can't really afford to not work. So you're jumping up in between your treatments and you're still trying to work. So I clearly understand those tears. I've had those tears, and I still have those tears. But the reason I call you a warrior is because it takes a certain amount of strength and fortitude to be able to continue to fight and fight and fight and fight, and to work and to deal with your children and to try to keep everything together when you don't even know, if you're going to live or if you're going to die yourself. So I sincerely, I empathize with you, and that's why I am privileged to be able to give you this scholarship so that you can come do the review, and we can use every single technique and tool and trick and teach you the content and do everything that we can do to make you successful, so that when you are finished with your treatment, you will be that RN, and you will be a very compassionate RN, because nobody knows what it's like to suffer until they have suffered, which is why I'm calling this Takes One to Know One, because I have definitely been there. So tell us a little bit about the financial hardship that's been caused, and in terms of insurance, and who's helping you pay for these surgeries, and because I mean the debt is unbelievable. I can't even remember the exact amount, but I know after my surgery, I had to go on like a 4-year payment plan to try to pay all the bills because the chemotherapy is thousands, sometimes it's $10,000 or more for one chemo treatment. And then the drug Neulasta, which is supposed to increase your white blood cells, that drug is very expensive and it causes so much bone pain. I used to have pain in my ears. The 3 bones in my ears used to hurt me, which is crazy. So nobody really understands the suffering. Nobody understands the pain. Nobody understands the financial implications. They just say, oh, well, she's just having surgery. Oh, but they don't know. So that's why I sincerely can understand your pain because I've experienced that pain. So tell us a little bit about your financial, where you are right now financially.
Um, well, I've been when I was working, I've, collected my, or I should say, have my annual and my sick leave. So with that, I try not to use that too much, knowing that something may happen where I would really need that time. So eventually, I didn't expect to be going through treatment for so long. So eventually, I tried to save as much time as I could just to make sure that my insurance is covered because I find that to be the most important thing to get covered. Um, but now that I ran out of time, I'm seeking voluntary leave donors from those that work in the agency as well.
So you mean you have people on your job that are donating time for you or to you?
They can do that. It's a slow process, but people are providing whatever they can because it's COVID time as well, and people have their own personal stuff to deal with as well.
Have you reached out to any agencies for support, financial support?
Um, I have American Cancer Society. They paid for my flight to come up to
Okay.
Maryland to do my treatment.
Come up from Virgin Islands or Puerto
Yeah,
Rico or from
yeah.
Virgin Islands.
Mhm.
Okay. So they paid for your flight. Okay. And any other support that you receive financially?
There was also an organization in the Virgin Islands, the name Cancer Care VI, I think it's called.
Okay.
They also give you uh, whatever little monies they can to go towards transportation or
Okay.
food or whatever you may need.
So
And
that's a good thing because for me, the one that pops out in my head is two actually. There's Thriving and Surviving Support Group, which is in Georgia. The owner or the director, her name is Rhonda Williams, and she's been very supportive in terms of my journey. Very encouraging. And she's actually the one that told me, don't do a lumpectomy, don't remove one breast, remove both breasts and get rid of it. And I'm glad I did that because I've met so many women that decided just to do a lumpectomy or one breast and then the cancer came back in the other breast. So that's one support group that I would definitely recommend. There was a group called the Pink Fund, which is in New York somewhere, maybe in Manhattan. And I remember one time they gave me some funds to pay my utilities. And then at some point I developed a blood clot and I went back to them and I said, hey, I need some more money. And they gave me a little bit more money again to pay my utilities. So I'm just saying that to say for anybody that may be going through cancer, there are agencies out there that will help you and support you. You just have to do the paperwork. You just have to show them the documentation, provide the paper trail. And there are agencies out there that are willing to help you because even though I was a registered nurse, master's degree, cancer wiped me out financially. So it doesn't even really matter the type of money that you make. If you have a diagnosis that's going to cost you $70,000, $80,000 in debt, it really doesn't matter what your occupation is. It will wipe you out.
yeah.
So, it's tough. It's really tough. And I just want to congratulate you on your fortitude. And you're a 10-year survivor and I'm an 8-year survivor, but you're going through it the third time. I went through it one time, but I just want to encourage you to continue to fight and to hang in there. And there is light at the end of the tunnel. I know that's a little cliche-ish, but I'm still here. And like I said, I've lived to see my daughter's 19th birthday, and I'm prayerful that you are definitely going to do the same. And as we close, what would you offer advice to a student that may be battling cancer, or that they don't even have it yet, but it may come up? Because during my time teaching, I've met many students that after I shared my story, 6 months later, they come up to me and say, I just found a lump in my breast. And if I never shared my story, they would never share their story or know where to find resources. So this is why I'm very transparent about my cancer survival, because there's been so many people that I've been able to help. Whereas if I would have kept it a secret, then they would have never known. So what advice would you give to a student that is battling cancer or that will battle cancer? What would you tell them?
Um, for those that haven't actually experienced it as yet, I would say for women, even men, because explore your body, especially females. It doesn't matter. You don't wait till you're in your 40s or that whole 40s, 50s thing. Throw that out the window, because cancer is affecting people way younger than that, especially breast cancer. And for me, my first battle was in my 20s. And I've heard a lot of people say, oh, people don't get breast cancer in their 20s.
And they
And
do.
so if you have that mindset that, oh, you're too young, you're in your 20s and you won't get it, then you're going to miss that time frame for you to be like, okay, yeah, this was there and I ignored it because they say I'm too young to have breast cancer in my 20s. And if I had that mindset, then I probably wouldn't have been here. It would have probably grown and spread somewhere else. But because I didn't feel comfortable with this lump, and it's like, I don't feel comfortable. Let me check it out. And only because I do my own little self breast exams is why I even felt it.
And
If
not
I,
only once, but you saved your own life twice. So
yeah,
just to throw it out there, just in case we have anyone that's listening and may not know, the breast exam should be done 7 to 10 days after the first day of menstruation. If you're menopausal and you're not menstruating, it should be done on the same day of the month. So it said, like, pick your birthday. So if your birthday is on the 8th, you want to do it on the 8th of the month. And I also want to say that men should do it as well, because men do get breast cancer, which is something that men may feel like, oh, well, I don't have to check my breast because it's only for women, which is not true. So
exactly.
you would definitely recommend the breast exams. Is there anything else you would like to recommend in closing?
For those going through it, don't give up. It's tough, especially if you have family, because me trying to go to treatment and trying to keep it a little um not secretive, but don't want to get my daughter worried. She's like, "Oh, you're going to a next appointment," so it's more like an appointment for her, and she's not sure exactly what type of appointment it is. And then going from there, coming home, and helping her with her schoolwork, because everything is virtual now, so you don't really have that personal time. Okay, she's at school, you could rest a day, but you're there together, you know, at that same time. So it's very hard, but not to give up. I recently have come across other young adults going through the battle that have children as well. So they are my motivation as well. They have 2, 3 children, and they're, sharing their story. And it's like, okay, I could do this as well, you know?
And that's what I think was very empowering for me when I got around other women. Because at the time, believe it or not, when I was diagnosed, I was working as a hospice nurse. And most of the people that I was seeing were dying of cancer. So now that I get diagnosed with cancer, I'm like, okay, so I'm dead. Like, I immediately just assumed I was dead immediately. But once I got into the particular support group that I was telling you about, Thriving and Surviving with Rhonda Williams, and then I started meeting all these other women, and I was like, wow, these women are beautiful. Like, good thing we don't look like what we've been through. Okay.
Yeah.
So it was just amazing. And they just gave me encouragement. Some of them were just starting the journey like I was. Some of them were 5-year survivors, 10-year survivors, 20-year survivors. So sometimes people say, oh, I don't want to be in a group. I don't want to be in a group. But I can say personally, that was what was helpful for me. because I latched onto those women and I felt like, well, if they did it, that I could do it. And, you know, those lonely, tearful nights, I don't know if you get them, but, you know, you're just sitting there, you're thinking about the bills, you're thinking about trying to work, you're not feeling well. You're just thinking about your family. Are you going to be able to afford the treatment? Your life is on hold. So my life was on hold for about 2 years, but it's not really on hold because you still have to try to work because you need the money. And then your family still needs you. So you can't tell your daughter, you know, I'll be back in 6 months. So it's just so much pulling and pushing and tugging. And I just wish that more people were aware of what it's really like for a woman or a man to battle cancer, and that there was more help available, and that you didn't have to fight so hard. Because the worst thing is you're going through cancer, but you have to be up at night filling out applications to try to get financial support, and you're not even feeling well. So I just wish, my wish would be that, you know, people would be a little bit more compassionate, because I guess the thought process is, well, it doesn't affect me, so I don't really care until someone gets it. Then all of a sudden they realize, which is why I say it takes one to know one. So I see your shirt said something. Could you lift up so we could see? Stronger than cancer. And you are absolutely stronger than cancer. I just think that any woman that survives cancer, it doesn't even have to be breast, or anyone that beats cancer, you just really need a warrior spirit, because it is like your worst nightmare ever coming through. And you always have this thought of death in your mind. Yes. Even because you've been through it 3 times. So, you know, it's like, well, am I going to beat it this time? You know, is this my last chemo? Is this my last surgery? Like, you just never really know. So, Letitia, I just wanted to tell you, thank you so much for taking the time to talk to us today. Your testimony is powerful, because there's so many women that suffer and struggle in silence. And it's women like us that are not afraid, that come out and share our story, that help us to help other women. And I just applaud you for having the strength and the courage to come out today and share your story despite your tears. So you are a wounded healer, or healing wounded warrior. I don't even know what to call you. You're just amazing. So thank you so much, and just continue to fight. And I think my July review is going to be my best review ever in 18 years, because I'm going to have to pour everything into your spirit to make sure that we get you to pass those state boards, so that you could come back with a powerful testimony and help others. And my last question, I know I said my last question a lot of times, but what area of nursing do you think you want to nurse work when you pass? I'm not saying if, I'm saying when you pass.
I like the emergency room.
Okay.
Yes.
Okay.
I actually was a CNA in the past, but I didn't renew my license because I was going through treatment and what have you. So that kind of got overlooked. But yeah, I really love the emergency room, or even med surge.
Got you. Okay. Well, thank you. Do you have any other final words that you would like to say? I think we kind of covered everything.
Yes. Thank you for the opportunity, and thank you for driving me to do this, because I didn't even think of, doing something like this here publicly. So it's kind of opening me up to, sharing my story, because a lot of people are out there, like you said, suffering in silence. And for me, before, it was like, oh, I'm too young to be associated with others that are older than me, for them to understand how I feel, going through it. But it doesn't necessarily have to be that way.
And I remember when I used to go for treatment, I always used to say to myself, like, why are you in this place? Why are you coming to a cancer center? And like you said, when I look around, sometimes it will be older people there. And I'm like, I'm not supposed to be in a cancer center, but cancer, there's no face, there's no race, there's no age. It does not discriminate, and it can happen to anyone. And like I said, people don't really take heed to what it is until it affects them. So again, thank you, thank you, thank you. You have been amazing, and your testimony is definitely going to help someone. And I always feel sometimes like that's why we did go through it, so that we could have a testimony, so that we can say we did it. So now it's your turn to encourage and inspire other women and men. So thank you, thank you, thank you, thank you. And I'm going to come back and interview you again after you pass your state board.
All righty. Thank you.
You're welcome. Thank you.